I'm basically trying to find out why people with osteoarthritis have pain and why it is so difficult to treat this pain condition. And I'm sure almost everybody in this room knows somebody who lives with arthritis and chronic joint pain. It's a huge burden in Canada and around the world. And when I talk to people living with osteoarthritis, basically all of them tell me their quality of life could be so much improved if they just could get rid of the pain. And I find it really staggering to hear stories from those patients pretty often that they go from doctor to doctor, try treatment after treatment for years and sometimes decades without getting any sufficient pain relief. And I had chronic pain myself for a while, and I know how devastating this chronic pain can be on your quality of life. And those stories basically keep me motivated in the lab to look for new ideas and new approaches to treat this pain condition. And the main reason why we're still not able to treat osteoarthritis pain sufficiently is that we still don't really know the cause of it. We don't know, for example, why, for example, Tylenol works in some patients for the pain. In other patients, it doesn't do anything at all, even though both patients have osteoarthritis. So to get a better insight into those mysteries, I'm working with animal models. So we are using animals where we induce osteoarthritis, for example, in a rat. So this rat gets osteoarthritis and gets joint pain. Now, it is extremely difficult to assess pain in animals, because animals can't tell us about their subjective emotional experience with the pain. So I use a very unique approach, and I record from those nerve efferents supplying the joint. And what I've found is that after you induce osteoarthritis and those rats get symptoms that are similar to those seen in humans, those nerve efferents become highly sensitized. That means they're constantly firing nerve impulses into the brain, and those rats then feel pain. And now we can go ahead and apply a compound locally to the joint and see if we can reduce the activity of those nerve fibers. And in that case, we might have a potentially novel painkiller. And to facilitate the translation of our preclinical research into a potentially clinical application, in the last couple of years, we made a big effort to collaborate with big pharmaceutical companies. We have an industry research grant with Eli Lilly, not just as a sponsor, but as a real equal research partner. And in a joint effort, we're trying to come up with new ideas and new compounds, trying to understand osteoarthritis pain, the origin of osteoarthritis pain, and come up with better treatments to improve the quality of life of patients living with this disease. Thank you.